Hi guys, I'm Kerry, and today I'm going to be telling you a little bit about Group A streptococcal infections, otherwise known as GAS infections. There is a lot of information, so I'm probably going to go fast, and I'm sorry for that. So, Streptococcus pyogenes is a species of gram-positive, non-motile, and non-spore-forming bacteria. It doesn't do very well in harsh conditions. It is classified by Rebecca Lansfield as a Group A bacteria, which means that they are catalase and coagulase negative, and they're composed of something called rhamnose N-acetylglucosamine. They're very small, around 0.6 to 0.1 micrometers in diameter, and they have a pretty short incubation period of around 2 to 5 days. They're most commonly found on the throat and skin of humans, and they can cause infections in the tonsils, sinuses, skin, blood, middle ear regions. Typically, this bacteria likes anything that has a mucous membrane. That's most likely where you're going to find it in a human person. They diagnose it by putting a swab of this bacteria on a blood agar plate and then seeing what it does to the blood. If it causes this beta hemolysis, the total destruction of the red blood cell, that's going to be a streptococcus as opposed to any sort of other bacteria. So as you can see here, it's cocci, and like I said, it forms beta hemolytic chains. It can be seen in pairs of 2 all the way to pairs of 24, so they can be pretty small chains or really big chains. So it has a couple different virulence factors on the bacteria itself. However, the most important ones are these 3. So it has an M protein and lipoteichoic acid that helps it attach to the cells. It has a hyaluronic acid capsule, and that's what inhibits the phagocytosis, which makes it really hard for our white blood cells and our other cells to kill. It can produce an extracellular toxin that can cause a couple different types of infections in our bloodstream and in our body. So the M protein is really unique on this because it allows for different mutations. So this bacteria, this species has 150 strains, if not more. So it can do a lot of different things, and they can all be slightly different. And those variations we see presented in that M protein. So we can see this bacteria in humans from as early as the 4th century BC in the writings of Hippocrates. He describes this outbreak in his community where women and men got very sick. They had flushed skin, they had crampings, all of which are common results of a streptococcus infections. From there we can see evidence of it in the 12th century as well as the 16th century. There's an outbreak of scarlet fever in Europe. And then there were continued outbreaks in the 17th century in places like Germany. We see it come to America, especially North America, in the 17th and 18th century. And then we see outbreaks throughout America and Europe all until the 20th century. We start to finally know more about this bacteria when George and Gladys Dix discovered the streptococci bacteria and determined that that was causing so many infections in humans. And then in the 1940s, with the invention of antibiotics, we truly start to control the bacteria and reduce the effects of it. So this bacteria can be transmitted from person-to-person contact, from things like shaking hands if you have an infection on your hands. It can also come through saliva or nasal secretion, so if you blow your nose and you have it, or if you sneeze and it gets somewhere and then someone else touches the surface that you sneezed on, they can get it. And then in very rare circumstances, it can be foodborne through improper handling of food. However, that is really rare. That typically doesn't happen, especially with all the requirements we have on food preparation. So some of the factors that increase your likelihood of getting a GAS infection are your age. It typically comes in people from ages 5 to 15 and then over 65. We see it in children or senior citizens, usually not in between though, because that's when you have the most underdeveloped immune system in your life. We also see it in people who have a weakened immune system, like if someone is HIV positive, or if they have a chronic disease like cancer or diabetes or heart and lung disease, they're probably going to be more likely to get a GAS infection. And then things such as drug and alcohol abuse and like narcotics abuse, that sort of stuff, that also increases your likelihood of susceptibility. So there are a couple different types of GAS infections. The first 3 are going to be your non-invasive and then less serious types of infections. So there's streptococcal pharyngitis, scarlet fever, and pedigo. And then our last 3 are going to be your way more serious invasive types of GAS infections. So here we see acute rheumatic fever, necrotizing fasciitis, and then streptococcal toxic shock syndrome. So first and foremost, there's streptococcal pharyngitis. That's what we commonly call strep throat. From the outside, it kind of looks just like your regular common cold. You get a fever, you get a sore throat, it hurts to swallow, you have swollen lymph nodes, especially around your neck, your whole body feels a little bit achy. However, what sets this apart is this red spotting that we see here. That's what doctors call strawberry mouth. You can see the red dots all the way from the tonsils, the adenoids, to your tongue. Furthermore, this sudden sore throat is really rapid in onset. Usually you'll go to sleep fine and then you'll wake up in the morning and feel really sick and have that scratchy throat. And then on top of it, nausea is a really big symptom. It feels like your stomach is cramping and it feels like you're about to throw up, and in little children oftentimes they do throw up because of it. This usually occurs when the strep bacteria will get into your mouth and your airways. That's typically when we see a manifestation of streptococcal pharyngitis. Moving on, we see scarlet fever. So some of the common symptoms of this, obviously a fever. It's usually around 100 degrees Fahrenheit to 103 degrees. It involves a red rash that we see in this picture right here. It starts in the trunk of your body and then moves to your arms, up your neck, down your legs. It's really red. It feels like sandpaper when you touch it, and it's also really warm when you touch it. It's definitely painful, and then you get a lot of red dots, especially on your tongue, like we saw in strep throat. It can occur in conjunction with strep throat, or it can also occur on its own. They aren't dependent on each other. Scarlet fever is actually caused by the toxins that I told you about, how it secretes the toxins. That's how you get scarlet fever from this bacteria. Then the last non-invasive one that we see is impetigo. So this typically occurs in children ages 2 to 5. It's very rare for someone older than that to get it. You see it around your nose, your mouth area, your hands, and your feet sometimes. It kind of looks like a little bit just like pus-filled like sores, and then when they burst, it causes this yellow, like we see in this picture right here, this yellow scab to form over it. This can happen when little kids stick their hands in things, they get bacteria, and then they wipe their face a lot. They can come from that, especially if they have little abrasions on their face or on their hands or feet. They get that bacteria in there, then it starts to form. The most serious bacteria are the most serious infections are the invasive types of infections. Starting out with that, we have acute rheumatic fever. So this typically only comes after you get some sort of strep throat infection. It's most common in people who have some sort of chronic illness. So doctors who see strep throat infections in people with leukemia, Lyme disease, gout, that's when they're going to be on the lookout for this. It normally doesn't happen in someone who's healthy or who has been on antibiotics before this. So some of the symptoms are really broad. It's things like arthritis, achy feeling, sore feeling. You get these subcutaneous firm nodules. It's very hard to diagnose in the respect that there are a lot of different symptoms that manifest when you have acute rheumatic fever. So the grossest one, in my opinion, is necrotizing fasciitis. It's a flesh-eating disease, and this is if you get a cut, you're walking, you get bacteria right in your foot. It starts to develop into a flesh-eating disease. Some of the symptoms include pain, swelling, tenderness, everything that you would imagine from a flesh-eating bacteria. Furthermore, it causes skin discoloration as well as your skin it dies essentially because it's being eaten by this bacteria. This is one of the more mild pictures. If you Google it, you can see some really awful cases where the entire skin on the top of the foot is gone and you can clearly see the bones and stuff. It's very severe. It can be really hard to stop once you have it. So doctors typically treat this pretty quickly, and they are very careful in their handling of it. And the last invasive GAS infection I'm going to talk about today is toxic shock syndrome. So this usually happens when strep gets into your bloodstream. This can be really serious. It can cause sepsis in your body, so you can very easily die from it. So one of the first symptoms is renal impairment. You get a low blood platelet count, and your bilirubin levels are really high. Your soft tissue starts to die, like we see in this picture right here. Her hand, the skin on it, is kind of starting to slough off because it's essentially dying. Furthermore, it can cause acute respiratory distress. So the treatments for this strep bacteria pretty much rely on broad-spectrum antibiotics. For almost all of these, you're going to see either amoxicillin, penicillin, or clindamycin. So strep throat and scarlet fever, definitely less serious. They're just going to give you some antibiotics. In Pedigo, they're going to give you an antibiotic cream. And if it gets bad enough, they're going to give you amoxicillin. And then acute rheumatic fever, they're going to give you a lot of different types of meds, especially depending on your personal circumstances. They're going to give you inflammation and fever management drugs and antibiotics. One of the common long-term effects of acute rheumatic fever is that it does weaken your heart a lot. So it can cause a lot of different long-term effects that doctors have to be quite careful in managing. For necrotizing fasciitis, usually doctors will do some sort of surgical exploration of the tissue, see how far the bacteria has gotten. If it has gotten far enough, they will have to amputate limbs. Hopefully that doesn't happen. So they're going to cut off the dead tissue. They're going to definitely do penicillin, ampicillin, clindamycin, tons of different broad-spectrum antibiotics, just to make sure it really does go away. And then as far as streptococcal toxic shock syndrome, what they're going to do is they're going to give you an intravenous penicillin. This is going to allow you to fight off the infection in your blood much quicker than you would without it. So if you're like me, you're probably thinking that's disgusting, and it's very common, very easy to get, but the easiest ways to prevent it are just good hygiene. Wash your hands, cover your coughs and sneezes, make sure to clean your contaminated surfaces, and then avoid public areas until 24 hours after your antibiotic therapy has started. That's when you become non-contagious. Furthermore, don't share your glasses, your utensils, anything like that. Try to avoid abusing alcohol and other substances like that while infected. So in the big picture, strep used to be very, very lethal. It would kill around 5% infected, whether it was non-invasive or invasive. The invasive rate of death was a lot higher pre-1900s, pre-antibiotics. Typically what they would do for treatment is they would kind of just set you on your own, hope that you don't infect anybody else, and then try and keep you comfortable, essentially. Today, around 700 million people get some sort of GAS infection each year. However, only 10 to 15% of them are fatal, and that includes the invasive and non-invasive. So you really don't need to worry about dying from it. It's pretty easy to treat with antibiotics, especially if you get in soon enough and you don't have any other complications. You're most likely not going to die from it. The places that you need to worry about this being fatal are third world countries, for sure. Places where they don't really have good antibiotics. Annually, there are only around 517 to 650,000 deaths. If you think about it, 7 billion people on the planet, that's really a pretty small number. Just because we are at a point in modern medicine where this is really not a big issue. So, I hope you guys learned a little bit about GAS infections.